everyone, good evening. I'm Shreya Dhoundial. Have you heard of people with double vaccination coming down with COVID around you? It's called breakthrough cases, and they are on the rise in the United States of America. In fact, even in India, we've heard of 37 officers at the Army War College in Mao test positive. All were double vaccinated. In the medical fraternity here in India, that was the first to be vaccinated, a debate is raging on booster doses as immunity does start waning after a while. What is this while? Well, the United States studied Pfizer's data to decide on booster doses and has found that the efficacy of its vaccine drops to 47% from 88% 6 months after the second dose. And the drop is not because of a more contagious variant, it's the vaccine that itself dulls down. The US has cleared booster doses for older and high-risk citizens. Israel is giving a boost up to all above the age of 12. European countries with the money and resources are going ahead as well. Interestingly, the WHO says there is only limited and inconclusive evidence on the widespread need of boosters. India, on the other hand, is saying they are studying local data to decide if and when to greenlight boosters. But the top priority right now is to vaccinate every adult Indian with 2 doses by the year end. Right now, 70% Indians have received the first dose, 25% have got both. Do you need the booster? I'm putting that question to one of India's leading vaccinologists, Dr. Gagandeep Kang. Let's start though with what exactly a booster dose does and who needs it.
We are healthy. We're doing more than every other nation in the world combined. We're going to have well over...
That's the President of the United States getting his booster dose of the COVID vaccine just days after booster doses were approved in the country. For those 65 and above, for those with certain underlying health conditions, and for adults at an increased risk of COVID due to their workplace, like doctors.
In a pandemic, we most often take steps with the intention to do the greatest good, even in an uncertain environment. And that is what I'm doing with these recommendations.
Soon after UK, Israel, Italy, Germany and France also decided to offer boosters to older adults. Now, the EU regulator has given member states the liberty to give booster doses to all above 18 years. But India is not convinced we need a booster dose yet.
Booster dose ki studies have been going on overseas. WHO has actually put a stop to initiating booster doses for vaccination because there is an alarming vaccine gap across the high-income countries and the low-income countries. But future में ये boosters का recommendation जरूर आएंगे.
What are booster doses and why do we need them? A COVID booster shot is an additional dose given after protection from the original shots has begun to decrease. Antibodies wane, but memory cells remain. The booster helps to keep the immunity going for longer. But there is no consensus yet among scientists and agencies that a third dose is necessary. The World Health Organization has repeatedly maintained that there is no need for boosters yet. The organization called for a moratorium on boosters till the end of the year to give nations enough time to immunize at least 40% of their populations against COVID.
There's the moral and ethical argument that you just outlined, which is why the Director General, Dr. Tedros, called for a temporary moratorium on booster doses so that the available vaccine supplies can be sent to those countries that have vaccinated less than 1 or 2% of their population. These are the countries where people are still dying of COVID. The science today is not clear on who will need a booster.
Even as the debate rages, Serum Institute Chairman Cyrus Poonawalla has said that he has taken a booster shot along with 7,000 to 8,000 of his employees. Natasha Menden for CNN News 18.
Now, Johnson & Johnson, that has approached the US FDA for its booster dose, says its single shot remains highly effective against COVID-19, at least till 5 months after the vaccination. But a booster dose after 2 or 6 months increases immunity by 4 times and 12 times respectively. So, which means if you take the second Johnson booster shot After 6 months, your immunity goes up 12 times according to the company. The booster debate is not just about data or efficacy. It is also a debate on vaccine equity. When 50%, in fact more than 50% of the world has still not got a single shot and demand still outstrips supply, is it fair for rich countries to look at a third shot?
To booster or not to booster? That is the question. While 55% of the world's population is still waiting for the first dose, some countries are already moving towards a third. In August, the WHO had called for a moratorium on boosters till at least 10% of the population of every country was vaccinated. That was later extended till the end of the year. But it didn't stop the likes of the US and the UK to start providing booster doses.
I called for a temporary moratorium on boosters to help shift supply to those countries that have not even been able to vaccinate their health workers and at-risk communities and are now experiencing major spikes.
Israel was one of the first countries to offer a booster of Pfizer's vaccine. It started with the 60-plus age group but was extended to the country's entire population. This week, the European Union's drug regulator said that those with weakened immune systems should get a third dose of Pfizer or Moderna's vaccine. The US has allowed a third dose of Pfizer's vaccine for those above 65 and people who are at high risk of severe coronavirus infection.
They are preparing for the likelihood that we will be giving boosters to individuals.
But are boosters necessary? A clinical trial shows that a Pfizer-BioNTech's booster shot increased the immune response in trial participants. With an increased immune response, people should have improved protection against COVID-19, including the Delta variant. The WHO has said that a third dose may be necessary for the immunocompromised who are most at risk. But this brings us to another question. Will booster shots in some countries block vaccines from reaching the poorest nations? About 69% of the population in high-income countries have received at least one dose of the COVID vaccine. But only 2.3% of the population in low-income countries have got jabbed just once. With the pace of vaccination picking up, should India offer booster shots?
फिलहाल तो बूस्टर देने की हमें अभी इस समय आवश्यकता नहीं लगती है। कुछ देशों में जैसा कि आप कह रहे हैं लगाना शुरू किया है, लेकिन हमें कब लगाना है और कैसे लगाना है इस बारे में यहीं पे कुछ वैज्ञानिक शोध चल रहे हैं और जैसे ही वो रिपोर्ट मिलेगी उसके हिसाब से ये निर्णय लिया जाएगा।
Perhaps the time has come for the countries and the companies that control the global supply of vaccines to think about the world's poor so that they are not under further pressure in the post-pandemic world. With Nivedita Singh, Anasya Kumar for CNN News 18.
I'm getting in Dr. Gagandeep Kang for a quick chat on who needs booster doses and when. She's one of the world's leading virologists. Dr. Kang, thank you very much for your time here on CNN News 18. There's a debate all over the world over booster doses. There is a medical side to the debate and there is a moral side to this debate as well. First things first, if I ask you, where do you stand on booster shots? Do we need it here in India right now or do we not need it?
Leaving out the ones that are elderly and the ones who are immunocompromised in the normal population are all vaccines considered equal. And it seems to be that while in general, protection is reasonably well maintained with 2 shots of most vaccines against severe disease, against infection, it drops off very quickly. We also have data from Israel showing that even in the general population, if you give a booster dose, that results in a decrease in severe cases and in deaths. So that seems to indicate that we should be thinking about booster doses, but when should we think about them? One of the things about Israel is that Israel gave its vaccine doses 3 weeks apart. Now, the vaccines that we have been using, the same vaccine used in other parts of the world has not been given at 3 weeks. So can we take data from Israel and apply it immediately around the world? I don't think that is the case. The other thing to remember that in India, at least half of people acquired their antibodies through infection and not through vaccination. And we know that vaccination and infection is actually the best combination to protect against infection, against severe disease, and against mortality. So while the data are very clear, elderly and immunocompromised, we should absolutely be thinking about booster doses at the earliest possible. What's not clear is when should we think about booster doses for the general population, and if we should think about them at all in the context of high rates of protection from infection that are very likely in India. It's an evolving situation, and that's before we get into the moral aspects to which you referred.
Dr. Kang, we'll get to that in just a bit, but are there any studies that are conclusively telling us when the second dose, do antibodies or resistance starts waning, that is after the second dose? And what exactly is it that the booster dose does? Does it restore your immunity to what it was after the second dose? Or is it 2 to 3 times more? We've read multiple reports, so it's a bit confusing.
So I think there's so much data out there that it's confusing everybody. What really matters when you need to make decisions for policy is not tracking antibody levels in isolation. Because antibodies you will expect after you've reached a high, it will come down. It declines with time if you don't continue to be exposed to the virus either through infection or vaccination, your antibodies will come down. If you look at children who were vaccinated, if we look at ourselves and we were all vaccinated in childhood, are we still carrying high levels of antibodies to the vaccines we received then? We are not. So we shouldn't worry about antibody titers by themselves. What we should be trying to do is look at the real world effectiveness of vaccines along with the antibody titers. Now, we don't have that data except in very limited settings. There are some hospitals, there is the army, there are some police forces that have reported protection from severe disease and from death. We don't have national level data. There is some data on the National Vaccine Tracker that is available from the Ministry of Health and Family Welfare, which says if you were vaccinated, this is your protection against death. But that doesn't tell you which vaccine, that doesn't tell you the antibody levels in the person, that doesn't tell you when people were vaccinated. So you can't really infer anything about what we should think about booster doses from that currently available information in India.
Okay.
I hope that will change with time, but we don't have the data yet to make evidence-informed decisions.
Okay, but there are countries that have already started booster doses. You've spoken about Israel, you've spoken about the United States of America. Now, once India is done with vaccinating its entire adult population with the second dose, that's when we'll start possibly thinking of booster doses. How soon should India start administering these booster doses, at least to protect the vulnerable group? Because after all, they were the ones who got vaccinated first.
So I think, again, we need the effectiveness data to show us how well the vaccines worked in the elderly in the last 6 months. We don't have that data stratified by age. So what are we going to base our decision on? When do you want to protect people? You want to protect people when they are at high risk of infection. Now, with 30,000 cases in the country on an average, are we at high risk of infection in the general population today? By and large, we are not. So I would prefer that the emphasis not be on planning for booster doses, but planning for using the data that we have already in this country. Absolutely, for the immunocompromised, we should be looking at giving them boosters. We could be doing this with antibody studies to see who responds, who doesn't. for the elderly, the people who are older and have comorbidities, again, I think antibody studies make sense that these are very defined populations. Within the US, there was a discussion around healthcare workers and whether healthcare workers should be considered high risk and whether they should be vaccinated. And the CDC director has now recommended that they be vaccinated. But the US is not India. You know, they have very high rates of cases still. They have never had the kind of systematic antibody surveys that were done in India that allow you to use that information for decision making. So I really think what we need urgently is our own data and our own modeling studies to tell us if we use the data on vaccine effectiveness, the data on antibodies, both in terms of the sero surveys as well as antibodies in response to vaccination, only then will we be able to make a decision that is based on science and not on being driven by what's happening in other parts of the world.
And then there is the WHO and Dr. Soumya Swaminathan, who has come out to say that booster doses are unnecessary. Because in India, there seems to be some opinion coming in from the medical community that you do need booster doses.
So what I'm saying is that you need boosters for a small part of the population, and you need to decide the strategy for that small part of the population, monitor it, collect data on them, make sure that we are gathering information as we vaccinate. Will the WHO change its mind 6 months from now, 3 months from now, 3 years from now? I think as evidence accumulates, WHO will likely go by the evidence. If it shows that boosters are needed, they will say that. The problem is WHO makes decisions not for the US, not for the highly vaccinated countries, which we are among. Actually, they make decisions for the world. And if you look at the world today, this is where the moral arguments come in. If you look at the world today, what matters more? Boosters in rich countries or first and second doses in poorer countries? Definitely it is first and second doses in poorer countries and underserved populations. That's what WHO is going with, and I think they're right to do that.
In fact, 57% of the world right now has not even got a single shot. Dr. Kang, when we do decide on booster doses, there has been some talk about how these booster doses should be specific against the Delta variant. Is that something that is possible?
So all of the vaccines are working against the Delta variant. Are you going to say this vaccine needs to be 30% effective, 60% effective, 90% effective against the Delta variant? You set that bar, then you can look at it. But every vaccine will perform differently in different locations because a lot of it is driven by the mix of the variants that you have and the time at which you see them, the prior history of the population. So I don't think we will be able to use a single cutoff and say, this vaccine is okay for this location, but not okay for that location. So there are efforts that are ongoing to look at whether we need new vaccines that are directed specifically against the variants. And we will have those vaccines evaluated. But those vaccines are like insurance. You may not need to use them at all, but let's develop them and keep them ready in case we need to use them. Right now, all the data that we have is that there is no vaccine that is failing 100% against any variant. So we should be reassured. Vaccines are working and we should be using them.
All right, Dr. Kang, always good to have you on the show, always good to have your perspective. Thank you very much for joining us here on Debrief. On that note, I'm slipping into a quick break on the show. Up next, we are telling you why Indian hockey has pulled out of the Commonwealth Games in the United Kingdom. That story up next. Do stay with us. India and the UK are currently embroiled in a tit-for-tat fight over vaccine racism. Now, both the men and women Indian hockey teams have pulled out of the Commonwealth Games in the country. They've cited the 10-day quarantine rule for all Indians as one of the reasons. All Indians who are double vaccinated, fully vaccinated. This is coming days after the England team pulled out of the FIH Men's Junior World Cup to be held in Bhubaneswar next month. Their reason? The mandatory 10-day quarantine that was recently imposed as a retaliatory measure on all UK nationals. The current UK rules state that all Indians, regardless of their vaccine status, will have to do a mandatory quarantine of 10 days. The United Kingdom is taking a lot of heat because of this decision, as the Oxford AstraZeneca vaccine, which is approved, is the same formula that is being manufactured by the Serum Institute of India. I'm going straight across to my colleague Sanjay Suri, who is reporting the story live from London. Sanjay, this is clearly not Indian hockey waking up, objecting to the 10-day quarantine and pulling out. This is a political decision. Are we expecting a political response from England?
Well, we are expecting an escalation of political response from both sides. So far, we've had a reciprocity by way of travel protocol, a decision in the UK and a mirrored opposite decision from the Indian end. But this is spilling over beyond that one-dimensional reciprocity. Clearly, this is a political decision, and it's going to go further from here inevitably. This month, Prime Minister Boris Johnson has been due in India. So then what happens? Does he go into quarantine? Clearly not. So an exception would have to be made for him, and that will create its own awkwardness. It will raise questions. If exceptions can be made for leaders, why not for others? Prime Minister Modi is due in the UK at the start of the climate talks next month. Again, what happens there? Clearly, this is having a political fallout. Piyush Goyal, the Commerce Minister, is due again in the UK this month to talk trade. Clearly, this is not going to remain confined simply to the travel protocol, which we have seen already, and it's going to go on certainly and without any doubt at all from the sports field into the political and economic fields.
Sanjay, then here's the question. It's baffling for most of us Indians as to why the UK is so hell-bent on this 10-day quarantine for everyone who's double vaccinated. Why this insistence? It just sounds very silly to all of us.
It is silly, and it's what appears to us seems to be the case is no different here, because there is no explanation from the UK at all why they are doing this, why they have taken this step. I mean, if there was a question, and this was an early question over the lack of a date of birth on that vaccination certificate, but the government said that for any purpose of travel, they can introduce that. So that meets that condition or criterion that the UK had set out. Possibly, they didn't even spell that out. There's no word from the UK government why they are doing this. What they have said is they recognize Covishield, they recognize the vaccine itself, but they do not recognize the vaccination with that vaccine. This is a very odd situation. I have not seen a UK government take such a view and such a stand before. It clearly defies logic.
It does defy logic, and it will be interesting to see what happens when Boris Johnson visits India and what happens when Prime Minister Modi goes to the UK. Will this 10-day quarantine period be waived off, or will things escalate and both leaders just cancel their trips? Who knows how this plays out, Sanjay? It's an interesting story to watch out for. Thanks for joining us. And with that, it's a wrap from me on Debrief. Thanks for watching. Good night.